Well, stem wave therapy is really exciting. It's been around for a while. It technically is shockwave therapy. So shockwave has been around for quite some time. There's shockwave to break up kidney stones. There's other sound wave and shockwave devices besides stem wave that are used for musculoskeletal injuries. But stem wave is actually the latest, greatest advancement in this technology of focused beam length, true, electrodynamic shock wave therapy. It actually sparks inside the electrode that's inside a water bathed head, and you feel this pow, this shock wave. And so what it does, and it focuses several centimeters deep, is that it really kind of creates a micro injury, if you will. And so it stimulates healing by recruiting. The body wants to heal that micro trauma. And so your body will recruit and send your own stem cells to those areas to help heal. And the relief is sometimes instantaneous. I did a guy last week who had been complaining of some problems with his lower leg and pain that was going on and had been chronic. And he's done some therapy, done a number of things, deep tissue massage, rolfing, you name it. And we did an initial, what we call a mapping session, where we worked through on different settings to find the point of maximal pain and maximal intensity, and then work on that area, slowly increasing it so that it's not, excruciating or painful. And by the end of that treatment, which takes 10 or 15 minutes, he was dramatically better. He made a point of texting me the next day saying, wow, I feel great. All the pain in my leg is gone. And he then, before he went back to his home in California, came in 3 times the following week for more treatments, and was very happy. I just had a treatment 15 minutes ago on my right shoulder. I severely tore my rotator cuff about a month ago, a little over that, playing way too much golf this summer, and hit a deep, heavy divot with a hybrid and long grass, and the result was not good. I felt it pull and tear when I did it. I had an exosome injection 2 weeks ago, and as of a few days ago, it was 70 to 80% better. I would say this morning it's nearly 90% better. I couldn't even lift this arm. I had to use 2 hands to eat, because just lifting my right hand was extremely painful. And so it's, a lot better because of the exosomes, and then the stem wave, shock wave, has triggered further healing. And, I just finished with a treatment. I'll do another one Friday. And hopefully within the next week or two, I'll be done and back to playing some golf. Well, we see athletes, and then we see everyday people. People in Aspen, Colorado are active. They're hiking, biking, working out, yoga, Pilates, pickleball, like everyone in America right now. Pickleball's the craze. And when you're an older athlete, let's say, and not perhaps working out every day, the big thing is obviously stretching, and you're tight, and you go out and you reach and go for a ball that's just out of reach, and now you've pulled your shoulder, your hip, you strained your knee, so we see all kinds of different injuries. We sometimes do injections with exosomes, with platelet-rich plasma, but always we want to follow with therapy, therapeutic exercise, and stem wave, and it's the results are significant. Well, really, any musculoskeletal injury of muscle, ligament, or tendon, as I said, shoulder, rotator cuff, biceps tendonitis, rotator cuff tendonitis, strains of the ligaments around the knees, ankles, hips, really everything, neck pain, back pain. We worked on a number of spinal conditions that we were able to help find, good pain relief. And the nice thing is it's natural. We're stimulating your body to help increase stem cell healing. And instead of giving a narcotic that, blunts everything, including ruining your hormone levels. And so I never write narcotic prescriptions for that reason. So, well, the stem wave device, I believe we have a picture on our website, or you can just Google stem wave therapy and see. It's a machine with a wand and a handle that has literally a cup at the end that is filled with fluid where the shock transmits from. We put a little ultrasound gel on the skin and then slide gently the shockwave device over the injured area, and it's loud. You hear it pop, pop, pop. They call it shockwave for a reason, and so it transmits that focused force deep into the tissues to help reduce inflammation and stimulate healing. After our initial mapping session, we reduce the price and sell a package of, let's say, 10 treatments. For most people, it's 8 to 10 sessions a day apart, so we usually do Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, something to allow the body to recover in between. We're recruiting stem cells, stimulating healing. The last thing we want to do is just keep it irritated. And so, we have to give the body a chance to respond. I think anyone that believes they may be a candidate probably is. And the easiest thing is to just go to our website, send us a chat message through our Engage chat link, or call us. It's aspen-regenerativemedicine.com. The link is at the bottom of the screen here. You can call at 970-201-1332 and set up a mapping session so that you can experience it yourself. Some people have immediate pain relief. Others, it takes it a day or two. But I think once you've experienced it, you will realize that, this is an interesting technology. It's not like anything else that's out there. And this is certainly the leader in the marketplace. StemWave has the best device I've ever seen.